I'm getting a tummy tuck because I lost a bunch of weight and now I have loose skin to deal with. We are currently 10 days out of the surgery, and today we are actually getting on a phone call with my surgeon where we're going to be discussing what's going to happen, what should I expect, and a bunch of other questions that I have saved up. Yesterday we woke up at 250 pounds because I was in the middle of a full-on Crohn's flare, but we did a fast and I think I actually figured out what the problem was because I was still bloated this morning, and it was sugar-free drinks. These kinds. So what we're gonna do today is I'm actually going to eat incredibly bland foods just to make sure that it is in fact the chemicals from these and not actually the volume of food, because if it's the volume, then obviously we're going to have to address that differently. Which means that my food today is going to be incredibly bland, except for my Elevate, which is hands down going to be the only enjoyable part of my day. Depression. Use code Goliath at checkout. So now I'm just gonna eat this very boring food, and we're gonna get on a call with Dr. Law so that we can see exactly what is to come.
All right, great.
Hey, how are you?
Doing well, how are you?
I am really excited for this call.
Yeah, it's been about 3 months, correct?
Yes, 3 months since this. It's okay. I have to say, I've seen a lot of surgeries now because I've been obviously like doing my whole internet surgeries. I have never seen a surgery for loose skin and gyno that not only is almost, well, the scar is barely visible, but it actually accentuates my chest line by creating like a bit of a shadow and makes my chest look even bigger. So I'm not mad about it.
I'm so glad. Yeah, you look fantastic. So that is, one of the fine points of this procedure is obviously it creates a significant scar. If you're going to remove skin excess, you're going to have a scar. And scars are forever, right? Scars don't magically go away. So the key is to plan the surgery so the scar is hidden in that crease at the bottom of the inferior origin of the pec major muscle. So it follows that kind of curvilinear line where you're cut from lots of effort on your part, and it makes the scar just kind of disappear.
No, it's amazing. And yeah, no, I mean, like, so far, it's funny actually, because I made that one video and like talking about like the corrective tattoo, and you were like, don't even consider that now, and like, well, this nipple is almost done, fully repigmentating, so we're almost there.
You're not even 4 months post-op, and it looks like all your pigmentation is back, which is fantastic.
Yeah, no, absolutely. Leading us into the next one, the next surgery.
Right.
One thing that I said on one of my last videos is like recently, and this is something that I never ever used to do before, but like more recently I've been like doing this thing where I'm in the mirror and I'll just sort of like pull it back to try to envision what it's going to look like. And it's crazy to me because like I never did that before because I never thought that it would actually ever happen.
Right.
So yeah, so I don't know if you saw, but I was kind of having fun yesterday, and I did some lines as to where I thought that the scars could possibly end up. And
sure.
Tell me how off base I was. So I had done a line that was a little bit lower here, and then I did a line that was a little bit higher. And then I tried to explain that if we go lower, the issue here is that if we go too low, we won't be able to get, like I said, like to tighten up the skin around my entire abdomen, versus if we go a little bit higher, then we'll be able to get everything. Only issue is then that obviously the scar would be a little bit more visible, which to me doesn't matter.
Sure. Well, here's how a tummy tuck works, and this is an important concept to understand. So we are going to elevate the entire skin flap from your abdominal wall. So we're going to make an incision that's fairly low. My goal is for a male tummy tuck scar to be below waistband level. So if you're wearing the average pair of shorts or swim trunks, the scar is completely concealed. And so we make a low incision just above the pubic area, and we elevate the skin flap from the abdominal wall. And when we get to your belly button, when we get to the umbilical stalk, we'll make a circular incision around the umbilical stalk to separate it from the abdominal skin flap. And then we'll keep going and reflect your abdominal skin away from the abdominal wall all the way up to your sternum.
Okay.
So the entire abdominal skin is going to be elevated from the abdominal wall in sort of a triangular shape. Basically the incision's down here, and the area that's undermined is basically this, sort of a big triangle, if that makes sense.
Oh, that does make sense.
That skin is elevated away from the abdominal wall so we can pull it down and get rid of the excess. And so it's not just going to improve skin tone locally where the incision is, it's going to improve the skin tone of your entire abdomen, upper and lower.
Oh, crazy.
And then, we redrape it, remove the excess, and then we bring your umbilical stalk through the abdominal skin flap where it currently resides. So your belly button stays in the same place. You'll just have a new surgically created belly button because we're going to remove some skin right over the umbilical stalk and create a new belly button.
Right, okay, so the belly button itself doesn't ever actually get detached. You just sort of like cut a hole around it, and then everything else comes off, and then and then I guess you make another new hole where you're going to reattach the existing hole. That's a lot of holes in a sentence.
Exactly, and there's, when it comes to the umbilicoplasty, making a new belly button, or umbilicus is the medical term, we call it umbilicoplasty. And you can sort of be lazy about it and just make a circular scar, and there'll be suture marks around it, and it'll look very surgical. Or you can make an effort to try to create a natural-looking belly button where the skin of the abdominoplasty skin flap is kind of pulled inward towards the umbilical stalk. And that conceals part of the scar, and it makes it look like a cosmetically ideal, natural-appearing belly button.
It's very interesting that you said that, actually, because I had received, I believe it was 2 or 3 comments about how people had never seen a tummy tuck or an abdominoplasty with like a correct looking belly button afterwards, and how they always looked very stretched out and all this stuff.
Right. Yeah, it really is just a matter of knowing the techniques available, being willing to take the time and put some effort into creating a belly button that looks like a normal human belly button and not just like a circular hole in the skin flap. So, if you just bring the umbilical stalk up to the skin and do a circular closure, that will be visible from across the room as a surgical belly button. It doesn't look anything like a natural belly button.
Yeah.
So you really want the abdominal skin adjacent to the umbilical stalk to kind of cascade into that hole, into the umbilicus. And so the majority of the scar should not be at the skin surface of the abdominal skin.
Okay. So now, next question for you is, obviously we had talked about it a little bit. We have an actual, and I'm sure it'll be more of a decision that we'll make next week, because we're meeting up next week, which is crazy. So regarding the ab stitching, so I guess what is it that you look for? What is it that's, and like, because obviously the give here, or the positive, is the fact that obviously then my abs would be like more like stuck in together, but then I probably won't be able to train heavy for roughly 6 or 7 months.
No, it's not that long a time. So when it comes to abdominal wall plication or muscle repair, whatever you want to call it, whether or not you do it depends on how weak the abdominal wall is. And so, for female patients who've had 3 pregnancies, the abdominal wall is usually pretty compromised, and they have what's called a rectus diastasis, which means the rectus abdominis muscles, which, started out side by side, are now kind of spread apart, and there's weakened connective tissue in between the two.
Right.
And so, for a female abdominoplasty, you really always you're repairing the abdominal wall, and unless it's an athlete who's never been pregnant, maybe was heavier for a while and has lost a bunch of weight. I have seen a handful of patients who've had multiple pregnancies and their abdominal wall is completely intact, no laxity. They're outliers. Generally doesn't happen.
Yeah.
With male patients, with male abdominoplasty, it's usually a matter of whether or not the patient has been significantly overweight in the past, right? Because when you put on excess body mass, it's stored as fat. Some of it's external, some of it's internal, the visceral fat inside your abdominal cavity, and that pushes out on the abdominal wall. So if you've been obese for a while, your abdominal wall has been stretched out from visceral fat storage. And so it really is a matter of looking at how well the abdominal wall has recovered. Obviously, you do an immense amount of core exercise, and it really boils down to whether or not it seems like a male patient would benefit cosmetically from the rectus diastasis or abdominal wall repair. And I mean, looking at you in person a few months ago, looking at you live on video, I mean, your abdominal muscles are well developed. It doesn't look like they're weak. If you turn in profile, turn to the side, and then just breathe out and totally relax. Don't push it out, but just kind of let it go. Don't hold it back.
Yeah.
So maybe there's a little bit of weakness in your abdominal wall because you formerly, what is your weight now?
I'm 245, 242, depending on the day.
And what was your max?
372.
Right, so that's a 130-pound weight loss from where you were before. You've done an amazing job, an absolutely incredible job at rehabilitating your abdominal wall from having been that obese. But I think it's likely that there is a little residual laxity in it because when you're standing in profile and you breathe out and kind of relax your abdominal wall, it does project a little bit more than you probably want it to.
That was our live consult with Dr. Law. I really like doing these live. He's such a well-spoken doctor that he's able to make complex notions be understandable to the normal audience without actually dumbing down anything. Hey, you know what? Okay, so obviously for those that are still watching, I'm sure you know that I've been posting every day like a tummy talk update. So let me know in the comments what you guys think that the skin is going to weigh after the surgery.